Immunotherapy is a relatively new treatment in our armoury for treating cancer. It works very differently to chemotherapy because immunotherapy works with our own immune system. So it harnesses our immune system, or it revs it up so that it can do the job that it's meant to do, but it does it much more effectively against cancer cells. Cancer cells are often very clever and they're able to hide from the immune system, but by giving these drugs, they are no longer able to do that. So the body's own immune system is then able to kill the cancer cells and get rid of them, which is exactly what we want.
Immunotherapy is using my immune system to fight cancer, in my case, melanoma.
There are more than one type of immunotherapy, and it depends on your cancer type and the reason that you're receiving the immunotherapy as to the type of immunotherapy that you'll receive. In some occasions, people will receive 2 immunotherapies at once, which is called combination immunotherapy.
And it really goes back to the treatment team makes that decision as to how many drugs a person gets. And that's really based on many, many different factors. So the best thing is to discuss any concerns or questions about that with the treating team. So the different things they consider is obviously the effectiveness of the drug, but also potential side effects. So the treating team's the best people to ask in detail. And it is a really important question to be asking.
So the difference between immunotherapy and chemotherapy is that chemotherapy causes cell death, and so that causes the death of rapidly dividing cells, which results in the common side effects you see from chemotherapy, such as the hair loss and the nausea and vomiting.
So radiotherapy used to treat cancer is what we call a local therapy. In other words, you use like strong X-rays and you aim them towards a specific part of the body. For example, if somebody had some pain in their arm and there was a known cancer deposit there, you would target, if you like, or aim the beams towards that area of cancer to control the problems that the cancer is causing. So that's what I mean by local. It's specific to a certain area of the body.
Immunotherapy is effective in treating many different types of cancers. The effectiveness of the treatment is different for each type of cancer and the situation that you're receiving the immunotherapy.
Some of the questions that you might want to ask your treating team about is about the effectiveness of the immunotherapy or the immunotherapies that you're getting. With that, the decisions that they make are very based on the individual, so it is a good conversation to have them and to have with them, and they're very good questions to ask.
We did do a lot of research. You have to be careful when you do the research, and you have to be careful when you do the reading, and I guess stick to the reputable sources, which we were guided to particular articles and particular research. And in some instances we were fed that information by particularly my oncologist to ensure that it was reputable. The field is changing so quickly, and you have to be careful that what you're reading is reputable, is up to date, and what specifically does it mean.
Immunotherapy can be very effective in some people, not all unfortunately. And the other thing about that is that we don't know who it's going to be effective for and who it's not.
It might not work for everybody, like we understand that, but it's fantastic, I think. Like the amount of people that now have a chance, be it a shorter time or a longer time. I just think it's fantastic.
It's worth doing.
Yes.
It's not a treatment that will work straight away. It sometimes takes a few weeks to months to know if it's working. Generally, your doctor will order some scans after a number of cycles of treatment, and that's the main way we know if it's working.
I'm on a 12-month course every 2 weeks. I get a result to a CT scan this Thursday, which is my second CT scan, to see how things are going.
At the moment, the length of time to receive immunotherapy is around 2 years, but that's different in each circumstance, and certainly some patients have side effects, which means that we need to stop treatment, and so they don't have the full 2 years of treatment.
Even if people have to come off their immunotherapy because of toxicity or different things, we know that it continues to work even though for a very, very, very long time. And I guess because it's so new, we don't know how long a very long time is. Some people can be on it for the rest of their life, and that's how long it takes.